Welcome to Medical Dialogues Journal Club, your daily dose of health and medical news. I'm Mr. Zaman, and here is what we have for you all from the world of medicine. Meningitis vaccine to tackle drug resistance in Neisseria gonorrhea. According to recently published articles in the Lancet Infectious Diseases Journal, the climbing numbers of gonorrhea cases across the globe are an increasing health concern, and so is the increasing drug resistance of the responsible bacterium, which is paving way for novel meningitis vaccines. The declining effectiveness of drug treatments for the bacteria responsible, that is Neisseria gonorrhea, and the lack of a licensed vaccine to prevent the infection have raised concerns about the possibility that gonorrhea may become more resistant to treatment or even untreatable in the future. Meningitis vaccine have been recommended by the WHO as part of its roadmap to reduce the global burden of meningitis. This includes offering meningitis vaccine as part of routine childhood immunization strategies. Since meningitis vaccines have become more widely available, studies have shown that they also offer some protection against gonorrhea, and that even partial protection could reduce cases of the infection considerably. However, questions have remained about the impacts and effectiveness of using meningitis vaccine against gonorrhea. In 2016, the WHO set a target to reduce gonorrhea incidences by 90% by 2030. However, an effective vaccine was yet to be developed. The three studies suggest that the 4-CMEN-B vaccine may offer significant protection to young adults and to men who have sex with men who might be at higher risk of infection. Meningitis vaccine 4-CMEN-B provides 40% protection against gonorrhea. An observational study led by Dr. Winston Abara of the US Centers for Disease Control and Prevention used health records to identify laboratory-confirmed cases of gonorrhea and chlamydia, another leading sexually transmitted infection among 16 to 23-year-olds in New York City and Philadelphia from 2016 to 2018. These cases were compared with immunization records to determine people's vaccination status with 4-CMEN-B, which is licensed for use against meningitis at the time of infection. There were more than 1,67,000 infections, 18,099 gonorrhea, 1,24,876 chlamydia, and 24,731 co-infections among almost 1,10,000 people. A total of 7,692 people had received the 4-CMEN-B vaccine, with 4,032 receiving 1 dose, 3,596 receiving 2 doses, and 64, that is less than 1%, more than 2 doses. Full 4-CMEN-B vaccination, that is receiving 2 doses, was estimated to provide 40% protection against gonorrhea. One vaccine dose provided 26% protection. The authors, however, acknowledge some limitations. The findings may not be generalizable to wider groups because the data used were from people aged 16 to 23 years in 2 large urban settings in the USA. Additionally, the use of surveillance data means it's possible some participants' infection and vaccination status were misclassified, which affected the analysis. The 2-dose course of 4-CMEN-B is 33% effective against gonorrhea in adolescents and young adults. South Australia's ongoing 4-CMEN-B vaccination program is the most extensive globally, initially involving infants, children, adolescents, and young adults, with a continuing state-funded program for infants and adolescents. In an observational study led by Professor Helen Marshall of the Women's and Children's Hospital in Adelaide, researchers assessed the effectiveness of 4-CMEN-B against meningitis and gonorrhea as part of an infant, child, and adolescent vaccination program. The authors acknowledge some limitations here as well. While a meaningful reduction in the rate of gonorrhea among adolescents and young adults was not observed, this was likely due to small case numbers in this age group. The reported effectiveness of 4-CMEN-B against gonorrhea is consistent with other studies. Co-infections of gonorrhea and chlamydia may play an important role in disease spread and severity, but factors associated with rates of co-infections are not well understood. However, the analysis shows that 4-CMEN-B effectiveness was similar whether co-infections were included or not. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.